Hi everyone, myself Mbcn and I am here to discuss with you about psychiatric history collection. Psychiatric history collection is essential for the assessment, evaluation and diagnosis of psychiatric patient. And I am here discussing about the format for history collection. It includes the identification data, presenting chief complaints, history of present illness, negative history, medical illness, past psychiatric history, family history, personal history and pre-morbid personality. First is about the identification data. Here we collect the personal details of the patient including name, age, sex, address, education, occupation, income, language known, name of the doctor consulting, etc. As mentally ill, we can't completely rely on the data given by the patient. So data can also be collected from an informant who is in close relation with the patient. In such cases, the details of the informant too is described. Next is about the presenting chief complaints. It includes a complaint with which the patient is brought to the hospital along with the duration as per patient's or informant's words in chronological order. Then is the history of present illness. Here we chronologically describe each symptoms, its mode of onset, duration, intensity, course, any precipitating factors involved or not, and any associated problems like suicide, homicide, etc. Then is the negative history. Here we rule out the organicity like vomiting, seizure, head injury or any substance abuse or medical conditions or psychotic symptoms. Then is the medical illness. Here we describe about past or present medical illness, treatment followed, surgical procedure and details of hospitalization. Sixth one is past psychiatric history. Here we describe about past psychiatric complaints of the patient, its number of episodes, duration, onset, hospitalization, complete or incomplete remission, treatment undergone and the treatment result. Then family history. Here we briefly describe each family member, relationship with the patient, any hereditary diseases or psychotic disorders in the family. Then the understanding of the family towards the illness. Here we draw the genogram of the family including 3 generations and we box out the current family of the patient and draw an arrow mark to whom the patient is emotionally attached. Next, personal history. Here we describe about all personal details of the patient from birth till now under different section. First is perinatal history, describing about the antenatal, intranatal and postnatal period, including the maternal health, maternal complications, birth defect, type of delivery, postnatal complications and milestone development. In childhood history, it includes the age of weaning, primary caregiver, any emotional or behavioral problems during childhood and childhood illnesses the patient had. Next is education history, that is the age of starting of formal education, their academic and extracurricular performance, relationship with peers and teachers, school phobias or conduct disorders. In play history, we describe the plays